My name's Jason Roberts. I'm a professor at the University of Queensland in Brisbane, Australia, and I work as an intensive care unit pharmacist at the Royal Brisbane Women's Hospital. I've been really lucky in my professional career to develop a real focus on antimicrobial dosing. And the reason that I became very interested in this is because very early on, when I was a younger pharmacist, I could sense on ward rounds that we would have within the hospital and the intensive care unit that there was a difference of practice between different medical teams, and that was potentially problematic to me because I thought that if people are doing things differently, it's probably because there's no consistent answer which they can rely upon. And so I very quickly worked out that this was an important area to study, and so I really focused a lot of my time from a research perspective, informed by my clinical practice, to work on that area. I'm very happy to have been involved in the creation of a booklet which focuses on optimisation of antimicrobial prescribing and really trying to isolate the key considerations that a clinician should have when they are making decisions about how to use an antibiotic. Things such as the way that the drug is going to behave in the patient. So that means taking into account things like the pharmacokinetics of the drug. In the context, of course, of what is the likely pathogen or the known pathogen causing the infection. And of course, those two are very important, but intrinsic to both of those is how good is that likely antibiotic going to be against that pathogen. And that's why understanding the susceptibility of the pathogen to the antibiotic is really important, and why MIC, the minimum inhibitory concentration, is a key factor for any clinician to be considering when making judgments about using the right antibiotic at the right dose in the right way. So pharmacokinetics is the part of the booklet I'll talk about first. I think that it's a very important area to understand that the concentrations that you will see in one patient when they receive a particular dose can be vastly different to the concentrations you'll see in another patient who gets that exact same dose. That means, of course, that one of them may have a better concentration than the other, and what we're trying to ensure is that all patients have a specific concentration which has been shown in previous preclinical studies to be a very good concentration for killing that pathogen. So understanding pharmacokinetics allows us to pinpoint what are the reasons between individual patients which mean that they may need a different dose of drug, because once we know what that different dose of drug is, we can apply that to the patient and ensure that we get a better quality of dosing. And so pharmacokinetics really does underpin that. Pharmacodynamics, of course, works hand in hand with pharmacokinetics. So if we say that pharmacokinetics is the relationship between the dose of drug that's administered and the concentration that results. Whereas for pharmacodynamics, we say it's the relationship between the concentration of drug and its effect. So for bacteria and antibiotics, this is the ability for that antibiotic to kill the bacteria. And there we're looking at things such as the rate and extent of bacterial killing, and even suppression of emergence of resistance is something which we could consider, but we don't typically consider that much because it's very much an emerging area of knowledge. So clearly, if we understand that PK and PD are interrelated, then we're going to make better decisions in relation to overall PK/PD, which is relating the dose to the clinical effect. The booklet is really geared towards all individuals that are involved in making decisions about antibiotic use and antibiotic dosing for patients. So this transcends clinical microbiology, not only infectious diseases physicians, but of course all physicians that are involved in making decisions in really challenging patient populations. And of course pharmacists, nurses, infection control practitioners, they're all relevant. It's not just suitable for junior staff, it's also suitable for senior staff. There are some concepts which are quite complex, but they're relevant for those very high level decisions that often the more senior practitioner may be required to make that decision. And even if some of those people may not be the ones who are prescribing, it will help them understand why some decisions are being made at that prescribing level for optimization of an antibiotic for the patient. And that just allows a clinical team, I think, to function as efficiently as possible. And so I hope that all of those individuals can benefit from this booklet. So for designing the booklet, something which I thought made a lot of sense to do would be to go through things in a chronological order of how we clinically would assess a patient, both from a diagnostic perspective all the way through to a treatment perspective. And so having points in there about the role of the microbiology laboratory, the importance of diagnostics, MIC testing, and how that they are supplemented, of course, by considerations of pharmacokinetics and therapeutic drug monitoring where it's available as well, essentially summarises a typical sequence of how we would approach dosing decisions and treatment decisions for a patient. So to me that made a lot of sense, and I think that the flow of the booklet then becomes a lot easier for the individual to follow. And an addition which we included within the booklet is some case examples as well, so that they can see the theory being taken forward into a practical example, and hopefully the reader can then understand about how it can be applied in a really pragmatic way. So if there's one key message that I would suggest that people take away from the booklet, is just that antibiotic prescribing, including dosing decisions, is complex, and there are lots of factors that can be at play and that are relevant, and to be thinking about each of those as best as you can. So I'm not going to say that I think that it's renal function which is really important, it's the type of diagnostic test which is important, but just that there are a lot of factors at play, and I have more confidence that if people are thinking about as many of those factors as possible, then they're going to make a much better decision in the best interest of the patient. The booklet is available at the Medical Education Hub on the bioMérieux website, and it's available in print, and I hope you enjoy reading it.